When we are divided, we needlessly lose hundreds of thousands to a preventable global pandemic. Divided, we destroy our planet and fail to slow climate change. Divided, we put millions in the path of war, poverty, and injustice. Divided, we lose trust in each other. But when we come together, we can collaborate to solve our biggest global crises. Together, we can protect the planet for our children. Together, we can build a better future for everyone. Together, we can share our one world in peace. At this time of great need, we need each other now more than ever. Let's come together at one shared world.
I'm Jamie Metzel, founder of One Shared World, and on behalf of my volunteer colleagues around the world who are part of the One Shared World movement and our partners, it's my tremendous pleasure and honor to welcome you to our event today on vaccine equity, the interdependence challenge of our time. This pandemic is the ultimate manifestation of our interconnectivity. If we think of every person who's been infected as actually touching another person, we can think of this pandemic as a chain of people holding hands, wrapping around the globe many, many times over. And when we visualize this terrible crisis in that way, we realize that there is no us and them. There is only we. When we see people suffering in India, Brazil, Africa, and here at home in the United States and Europe and everywhere, it's not them, it is us. We are all together. And there are two categories for how to think about our response. One is using the metaphor of walls, and the other is through the metaphor of bridges. If we have seen anything to date, it's that we can't build walls high enough to protect us from this kind of global challenges. If the virus variates anywhere, it threatens all of us everywhere. And we are seeing, and increasingly must see, that in our interdependent world, the only way any of us can be safe is if all of us are safe. That's what One Shared World is about, and that's why we are here today to discuss this absolutely essential topic. One Shared World is the global interdependence movement. What we are trying to do is build an empowered global constituency of people all around the world working to ensure that our leaders best balance our national and local interests with our common interests as humans sharing the same planet. This pandemic, if we are successful, will allow us to prove that recognizing the mutual responsibilities of our interdependence must be the framework for building a safe future for everybody. But the challenge to all of us is whether we can achieve this. Can we come together to build a safer world for everyone, including ourselves? Can we lay a foundation to build that kind of safer world for everyone? Vaccine equity, therefore, isn't just the ultimate test of our humanity. It's the test of whether, in full recognition of our deep global interdependence, we can solve the greatest problems we collectively face for the good of everybody and for the good of ourselves. To do this, we need to reach deep and find the best in ourselves. We need to develop and realize smart strategies. We need to build norms, processes, and structures and institutions to help facilitate this process, and we need heroes. And it's my tremendous honor that we have gathered such a tremendous and a really incredible group of leaders who are going to join our essential conversation today. Before I introduce our first hero, just a few housekeeping points for the day. We anticipate hundreds of thousands of people who will join us and who this broadcast and engaged dialogue will reach. For all of you who are watching around the world, and many people are watching on various social media, on various websites, in your site, you can just add any questions or comments in the chat section, and those will all reach us. We'll be posting a number of those on the site as the conversation goes along. Second, at the end of our conversation, we are going to have a conversation forum that people can join where everybody can be speakers. That will be at the end, after this formal event ends, and we will show the URL for that site at the end of our conversation today. So the first person who I would like to introduce is really a great hero of mine and a great hero for the world. Dr. Tedros Adhanom isn't just the conscience of the world in this moment of crisis. He is actually one of our most practical leaders who is guiding us toward the only way that we can address this terrible crisis, which is together. It's my great pleasure and honor to introduce my friend, WHO Director General, Dr. Tedros Adhanom.
Thank you so much, my friend Jamie. Very nice to see you online, and thank you for inviting me to this very, very important meeting. And my greetings also to Seth, Larry, Peggy, and Kiran. I hope Aurelia is also there. Good morning, good afternoon, and good evening to everyone. And thank you for having me today. As you all know, vaccines offer real hope of bringing the pandemic under control. The development and approval of not one, but several safe and effective vaccines so quickly is an incredible scientific achievement. But the hard truth is that the world's richest people are benefiting from this achievement, while most of the world's poor are missing out. So far, more than 1.1 billion doses of vaccine have been administered globally, but more than 80% of those have been administered in high and upper middle income countries, while just 0.3% have been administered in low income countries. Unfortunately, this is a predictable and preventable situation. Over a year ago, WHO and our partners established the Access to COVID-19 Tools Accelerator, including the Kovacs Vaccine Sharing Initiative. Kovacs was designed to share the risks of vaccine development and to offer a mechanism for pooled procurement and equitable rollout. But many of the same wealthy countries that expressed support for Kovacs were in parallel pre-ordering the same vaccines on which Kovacs was relying. The upshot is that we have shown that Kovacs works, but we have not so far been able to distribute the volume of vaccines that we planned or hoped. So far, Kovacs has shipped more than 53 million doses of vaccine to 121 countries and economies, enough for just 0.5% of their combined population of more than 4 billion people. The problem is not getting vaccines out of Kovacs. The problem is getting them in. We continue to face severely supply constraints, and we're doing everything we can to find ways of increasing production. But ultimately, the solution to the vaccine crisis is for the countries and companies that control the global supply to share financial resources, to fully fund the ACT Accelerator and COVAX, to share vaccine doses, not bilaterally, but through COVAX, which is the most equitable way to distribute vaccines, and to share technology, know-how, and waive intellectual property rights. We know that production capacity can be expanded using voluntary licensing platforms like CTAP, the COVID-19 Technology Access Pool. Every government has an obligation to protect its own people. We understand. In time, there will be enough for everyone. But for now, the global supply of vaccines is limited. And we have an ethical, epidemiological, and economic imperative to deploy vaccines as equitably as possible. Vaccine nationalism will only prolong the pandemic, the economic turmoil it causes, the restrictions on travel and trade, and increase the chances of a variant emerging that evades vaccines. The pandemic continues to cost the global economy trillions, and trade has contracted faster than in the global financial crisis, with the poorest countries hit hardest. The World Bank estimates that 300 million jobs have already been lost, with 100 million at risk of slipping into poverty. The crisis has been particularly acute for women, who play a key role in running the small enterprises hardest hit by the downturn. Least developed countries and others highly dependent on travel and tourism continue to see demand suppressed by pandemic restrictions. And vaccine nationalism perpetuates the inequities that lie at the root of so many of the world's problems. We cannot talk about building back better if we cannot address this crisis now. Wealthy countries have the means to help their citizens weather the crisis. But many low-income countries are already burdened with debt, and declining revenues during the pandemic have only made this worse. While the shoots of recovery have emerged for some, it remains highly uneven, both among countries and within them. The fastest way out for all is to end the acute stage of this pandemic as quickly as possible, get supply chains and trade systems moving again, and focus on a fairer and greener recovery. Let me leave you with 3 ways in which you can help. First, if you live in high or upper middle income country, use your voice to call on your government to fund Kovacs and to share doses with Kovacs. Second, you can help support Kovacs by making your own financial contribution through the Go Give One campaign set up by the WHO Foundation. Go to gogiveone.org and donate. And third, remember that although vaccines are a vital tool, they're not the only tool. As long as COVID-19 is a threat anywhere, it's a threat everywhere. We must all continue to take the everyday precautions to keep ourselves and each other safe. The pandemic has demonstrated that indeed we do live in one shared world. We share the same DNA, the same planet, and the same hopes and dreams. We face shared threats, which we can only meet with shared solutions. I think about sharing, you have already said it, Jamie, very well. And also I enjoyed the video. This virus cannot be divided, cannot be defeated with a divided world. It can only be defeated if we do it together through solidarity. So thank you so much again, and back to you, Jamie, my friend.
Thank you so much, Tedros. I think everybody in the world is inspired by not just your words, but about your leadership and about really everybody at the WHO who in these very, very difficult times are doing so much to help make us all safe. And I particularly appreciated your message of empowerment. This isn't the kind of moment where everybody can sit back and wait on experts, wait on our governments to fix this problem. There are things that everybody can and must do to help build the kind of future that we all want to see. I know you only have time for one question, and we don't want to keep you too long, but as I mentioned earlier, One Shared World is a global movement, and it's a youth-led movement. We have young people, amazing young people from all around the world who are leading us and trying to help build this world based on the mutual responsibilities of interdependence that we all would like to live in. And so we've asked one of our young leaders, Yasmin Nerjeb, who's a student at the European University in Tunis, to ask you a question, Dr. Tedros. Yes.
Sorry for that. Hi, everyone. Hi, Dr. Tedros. My name is Yasmin Nerjeb. I'm a political science student in Tunis, and I'm also a co-leader of the events team at One Shared World, our organization, which is led by young people from all around the globe. Recognizing the mutual responsibilities in our shared interdependence is what brought us together today and within our movement. So, as a young person trying to take action, and also as a person who, alongside millions of others, has experienced loss after COVID, I would like to ask you, Dr. Tedros, what can young people in particular do to help make vaccine equity more of a reality?
Shukran jazilan, Jasmine. That was a very good question. Thank you so much indeed. First of all, I mean, we should start from realizing. Can you hear me?
Yes.
Yeah. So we should, the youth like you should start from realizing the inequity we have, the disparity. I think it starts from appreciating the problem. It's so serious. And I have said it in my speech. In some countries have already vaccinated more than 40 or 50% of their population, while in low-income countries, it's not more than 0.3%. That's very tragic. And especially the youth should not accept it. And you start from really understanding the seriousness of the problem, your own awareness. So the best would be to create the awareness among youth. You help them understand the extent of the problem. Then second, from that, then you influence others to understand the problem and to increase awareness of the rest of the population. From that, I think through movements, you have big organizations. The one like One Shared is a youth organization, as Jamie had said. So you use that to mobilize and for the world to contribute whatever they can. One thing which I have specifically, indicated in my speech is the Go Give campaign. At least there is one campaign which is running. You can mobilize to help that. By the way, a few weeks ago, Greta had joined me in one of my pressers, Greta Thunberg, and of course, her message was very, very clear. And we have seen the change since her, strong message to the world. I think you can make a difference. So I really appreciate for what you have already done, but I believe that we can do even more. So just focus on vaccine equity, mobilize yourself, and mobilize the world, and let's not accept the current situation, the current tragic situation that we have. Thank you. Shukran again, Yasmin.
Great. Thank you so much, Dr. Tedros. We could not be more grateful. Thank you, Yasmin. So Dr. Tedros, we are releasing you from spending time with us so you can go back to doing your important work saving the world. So thank you, thank you, thank you.
Thank you, Jamie. Thank you so much.
All right, bye-bye. So now it's my great pleasure. I mentioned that we have a cast of heroes in the offstage before. I was talking about Avengers, Ocean's 11, whatever the right words are, but really an incredible group of global leaders who are going to lead us in our conversation today about, one, why is vaccine equity so essential, and two, how do we actually achieve it, both in the near term as quickly as possible, and laying a foundation for a better future going forward. So it's my pleasure to introduce our discussants for today. Seth Berkley, the CEO of Gavi, the Global Vaccine Alliance. Kiran Mazumdar-Shaw, the founder of Biocon, and fun fact, Forbes' 68th most powerful woman in the world. Peggy Hamburg, the former FDA commissioner and the co-chair of the WHO Expert Advisory Committee on Human Genome Editing, which I have the pleasure of serving on. And Larry Gostin, O'Neill Professor of Global Health at Georgetown Law School. Aurelia Nguyen was going to join us in a tag team with Seth Berkley, but now he's able to stay for the whole time. So Aurelia is another superstar who won't be joining us. So let's jump right into this, Seth. We talk about vaccine equity often as a moral issue. But there's a mathematical justification for vaccine equity. If our goal is to just have the best outcome that protects everybody on Earth, this is the best strategy for doing it. Can you explain why?
Thanks so much, Jamie, for hosting us, and it's great to be here with you. Let me just start to say that our organization, Gavi, was established because of powerful new vaccines and the fact that they were being inequitably used. And so the idea was to bring these powerful tools to arguably those who needed them the most, those who are living in developing countries. And that's been transformational. 70% reduction in vaccine preventable diseases, contributing to a 50% reduction in under 5 mortality. So just to, vaccines are really powerful. Now, I think Tedros made the case on vaccine equity. We have a viral disease that started as a point outbreak and within a couple of months had spread across the entire globe. And the challenge in thinking about that is you are only safe if you're all safe, because if we have communities that are thinking they've completely vaccinated themselves and everything is fine. First of all, we've seen if there are other parts of the world who are not vaccinated, you see new variants appear there, because the more the virus replicates in humans, the more chance it has to go through some type of process of mutating and then being able to be a stronger and better virus to infect people. So what happens then is you threaten everybody. But the second thing that happens in terms of that process is that you cannot go back to normal, because you can't do trade, you can't do commerce, you can't do travel. And what that means is that we have to think about this as a global solution. The last thing I'd say is that, the way to think about this is trying to cover first those at highest risk across the world. My own belief is every healthcare worker in the world should be vaccinated by now. We then should move to the elderly populations who are at highest risk of dying, those with other comorbidities, and then we can think about the broader use of vaccines. And I think this is really important because that's the best way to equitably control this infection across the world.
Great. Thank you, Seth. Kieran, the world's eyes, and just as an example of what Seth was saying, the world's eyes are now on India. And I think everybody is heartbroken by the images, what we're seeing, what we're hearing about the situation in India. And I think it makes everybody realize that even if we feel temporarily that we may have reached a little oasis of calm and safety, that can be very fleeting for all of us everywhere, including where I am here in the United States and everywhere. Can you give, I know people are deeply concerned about the situation in India. Can you tell us a bit about your perceptions from the ground about the situation in India now? And what are the most urgent, we'll talk about the longer term steps, but what are the most urgent things the world can do now and we all can do now to help the people of India?
Thanks, Jamie, for having me on this wonderful panel discussion. I think we are discussing such an important issue on vaccine equity. Let me start with India's problem. When we actually started this pandemic last year, it was brought into India through international travel, and it was basically, it affected urban India first, and it got contained in urban India because we very quickly announced a national lockdown. And even though we had a mass exodus of migrant labor from urban centers, Fortunately, they were not infected and they didn't carry the infection to rural India. This time around, the second wave has hit us like a tsunami. And the unfortunate part is it has not spared any part of our country. This time around, both urban India and more frighteningly, it is rural India that has also got infected because we did have a bunch of state elections and a number of religious festivals that have really, really added to this horrific surge. And because of the surge of the infection and this virus, it has created an enormous surge demand on hospital infrastructure, so hospital beds and oxygen. We don't have enough human resources to manage the kind of numbers we are seeing today. We don't have enough medicines to treat patients with. We don't have enough medical supplies of most types to deal with this pandemic. And above all, we don't even have enough vaccines to vaccinate people fast enough. So I think, we're really, really very, very challenged because we are a huge country. If we were a small country, we could have kind of ramped up and caught up with the demand. But the enormity of our population is what makes it that much more challenging. And I just hope that, we can actually do whatever it takes to, manage the pandemic. And for that, I think the fact that we are getting so much aid and, these global contributions to India to help it fight this pandemic is most welcome. It actually shows that this is one shared world, because if India is not safe, I can tell you the world is not safe. And I really, really want to, thank you for hosting this show, because I'm very grateful for the contributions that might come in because of all the pleas that we are making on this show. And Give India is very grateful for your, offer to help with donations and funds that could help the people of India. So I'll end there.
Thank you so much, Karen. And just to reiterate that final point and connect it to what Tedros is saying and what we're all saying is vaccine equity is up to all of us. Everybody must feel, and I hope will feel, a responsibility to do your bit. Certainly there are some people who have greater capacity to do more, like world leaders, but every single person can do something. Tedros mentioned ways that people can reach out to their governments to contribute. When we asked Kieran for her suggestion of one charitable organization that she fully believed in that would help people tremendously, she recommended Give India, and we're in touch with the CEO of that organization. So we certainly hope that everybody who is listening here will consider making a contribution, no matter how small. The key point is joining this process of building a safer world. But as I said, there are some people who have greater capacities. And now, as we know, the G7 foreign ministers are meeting today, actually, and the G7 foreign ministers are joined by other foreign ministers from the so-called D10 countries like India and Japan and others. But we're facing this, in many ways, juxtaposition, because we know that this challenge is a global one, but the way that we are predominantly organized, just as humans, is nationally. And so, Peggy, you've been involved on many, many different levels, both in globally connected with the WHO, nationally as commissioner of the FDA, and locally, at least where I am, as the head of for the commissioner for health for New York. How do you think we can think about getting to the right balance? Whereas, as Tedros mentioned, our national leaders, the thing that we have elected them to do primarily is to protect us. And so they're interpreting that as, well, let's get everybody in our country vaccinated as quickly as possible. Then there's this other argument that Seth made eloquently, which is actually to achieve the optimal outcome. It's not just vaccinating your own country first. As a matter of fact, vaccinating your own country first, especially for a big country like the United States, achieves a suboptimal outcome, which is a longer and more dangerous pandemic. But Peggy, this is a tough question, but how can we think about communicating with our leaders and encouraging them to find a better balance between national and collective interests?
Well, thank you so much. Thank you, Jamie, for putting together this important forum and engaging this remarkable panel, and of course, Dr. Tedros. And, you know, the question you ask is such a critical one. It is enormously challenging often, especially in a crisis, to get people and political leaders to think beyond their own borders, their own self-interests, their own concerns. But without a doubt, as has been stated so eloquently already in this session, this is a global pandemic, a threat that transcends boundaries, where no one and no country can be safe until everyone is safe. And so it really does require a shared set of solutions and a new willingness to commit to working together and recognizing this common destiny and the need for shared solutions. But the way that I think political leaders can make a difference is to be able to understand that, first of all, and be committed to it, but then to communicate clearly why it matters. Here in the United States, there has been a huge push, as I think you know, to get the vaccine out to all Americans who want it, and enormous progress has been made. But we remain vulnerable. And the experience in India, I think, has really brought that home in powerful ways to people at the highest levels of leadership and also to the population. Seeing a place that had appeared to be managing COVID reasonably well suddenly explode. It reminds us that it is in our own vested interest to make sure that countries around the world have access to critical vaccines and access to other essential supplies as they try to manage and contain this devastating pandemic. The concern about ongoing spread in other countries, the concern about the emergence of variants that can potentially undermine immune protection, both natural and vaccine related, the fact that we cannot return to normal trade and travel in any country until the world is a safer place. And importantly, national economies will not rebound as we all so desire until the global economy is addressed. And we do live in an interconnected world, and the economy, as well as safety and security, is intimately intertwined. And the public, people in every country, need to understand that. Their leaders need to be committed. And I think importantly also, people need to understand that the time to act is now. We can't wait until every country feels completely comfortable and safe and then address the rest of the world. We have to do things in tandem. We need to address our national concerns, and we need to work together.
Thank you so much, Peggy. And we're going to talk about the specifics of next steps. But one final kind of setting the table question that I wanted to ask is to Larry. Larry, you've been for many years at the center of the conversation about, do we have the structures in place that would allow us to be ready for this kind of crisis? Certainly through the establishment of Gavi and the international health regulations and others, we've made progress. But on the other hand, I think everybody would recognize that we weren't ready. We didn't have the norms, systems, or structures in place at the beginning of this pandemic that could have made our responses at least more efficient. So, Larry, before we get into the specifics about critical next steps, can you give your kind of assessment of what had not we done? On the day that the pandemic started, we didn't have the infrastructure, the systems in place that we needed, not because we couldn't imagine them. I think you and frankly everybody in this conversation was in the business of imagining them, and they were pretty well articulated. Why didn't we have them in place? And what are the lessons we can learn from that failure that could supercharge our efforts, or at least our understanding of the problem now?
Yeah, well, thank you very much, Jamie. And, I wanted to just kind of step back and just reinforce what you and all of the wonderful panelists, all wonderful friends have said, that, every human being has the same yearnings, the same wants, the same desires. We all love, we all feel. And to think that the privileged are getting more privilege by hoarding vaccines and not equitably sharing them with the world, and more importantly, equitably sharing the technology, I think should offend all of our conscience. A lot of us think that this is a zero-sum game. We win, you lose. We hoard the vaccine and you don't get it. Is not true. We can actually make this a win-win. We can donate a dose of a vaccine to another country and we save a life. But if you share the know-how, you transfer the technology and you waive the intellectual property, as is being decided, as you said, Jamie, today at the World Trade Organization and the foreign ministers meeting. You can save a country and you can save a world. And so it's in all of our interests to be fair, just, because it's the right thing to do, but it's also the smart thing to do. So in answer to your question, almost everything broke down during this COVID crisis. Right from the beginning, the reporting of SARS-CoV-2, or a novel virus in Wuhan, was late to the World Health Organization. We didn't have systems on the ground for independent verification of country reports. Throughout the pandemic, we had weak health systems that didn't operate well, and strong health systems that could have operated well, but we had populist leaders that undermined science, undermined public health. And so going forward, we do need shared responsibilities. We're only as strong as our weakest link. So we have to build up health systems around the world. We have to make sure that we have global norms that are enforceable, so that everybody identifies and has good surveillance of novel viruses. And above all, we need to share technology. We need to share scientific data. We need to share know-how. That's really critically important for us, because going forward, what we've seen from this pandemic is that we've had a virus that is so wily that no country has really been spared. And we found that, we really were not up to the task of fighting this virus. But we also had on our side human ingenuity, as Seth said in terms of Gavi, vaccines, pharmaceuticals, medical technologies, and know-how. And that's been the answer. And what we need to do is ramp those up, make them quicker, faster, and share them more. There's so much we can do to make a more prepared world. And let's hope that coming out of this pandemic, we're not going to make the same mistakes that we've made throughout this pandemic.
Yeah, two absolutely critical points. One is that this isn't just about vaccines. It's about how do we create a system where people can be protected that includes vaccines, and certainly vaccines are urgent, but it's also about global public health, also about global systemic poverty and these underlying conditions. And the second point that you made, Larry, that I think everybody has made, and it's the essence of One Shared World, is that in our interdependent world, helping other people is a moral thing to do. But it's also the right thing to do. It's also the smartest, as you said, thing to do, because these problems are global. If the problems are global and our solutions are national or even personal, we aren't going to be safe. So let's now jump into some of the specifics about solutions. And I think our goal is to think strategically about what are the things that we need to do, what are the concrete steps, what's the right prioritization of those steps. So let's start with you, Seth. There's been a lot of conversation both here and in the world about COVAX and the ACT Accelerator. Not everybody listening, I think, will have the background. So just a sentence on what it is for everybody. But if you could give us a checkup of where things are with COVAX, what's working, and there are some things that are working really well. What needs to happen, and what are the steps to make those things happen?
Thanks, Jamie. And I loved hearing the comments from Larry and everybody else. So first of all, I mean, what really worked amazingly, as Larry said, is the science. So today there are 14 vaccines licensed in some place or another. And, the previous record was 4 years for a vaccine. That was for mumps. This vaccine, 327 days. Amazing, amazing encouragement of science. But what hasn't worked is getting that vaccine distributed equitably. Now, we knew that this was likely to happen because we had the previous pandemic. And so right at the beginning, we decided to form COVAX, and we decided to do it by bringing together the world, not just focusing on developing countries, which is normally where we are. And I think what's extraordinary is 192 governments came together, one being at the latest this week, representing 90% of the global population, to work together. And so I think that's the best part of this. Included in that is the 92 poorest countries, and making sure that we could provide vaccines for them free of charge, supported by other countries, because otherwise we knew that the financing would be their barrier. So the good news is we were able to go ahead and order more than 2 billion doses. And so that should move us towards covering those at risk. But part of the problem is with the India situation. India is one of our major suppliers. Of course, they wanted to make sure vaccines could focus on the needs in India. And so right now we have a shortage of vaccines. And one of the challenges is how do we get countries to now share? And what's interesting is the wealthy countries, because we didn't know at the beginning whether any of these vaccines were going to work or which ones, have bought a whole portfolio of vaccines like we have. And what that means is that already it's estimated that there's more than 1.5 billion excess doses that will exist in high-income countries. And so the challenge is, can we get those high-income countries to donate those vaccines and make them available? Second thing that's critical is ending export bans. Vaccine production is complicated, and the challenge is we have to have vital ingredients flowing around the world. And if we have export bans, it then stops production of products. We have 24,000 liters of production facilities right now that are not working because it can't get simple filters because one country's not exporting those. And so we need to stop that and work together to try to make sure every manufacturer is able to move as quickly as it can to do it. And then, of course, the third way is to buy more doses. We will continue. There'll be more announcements of doses being made available, and we need, obviously, the finance to do that. And in doing that, we can accelerate the provision. So you heard already from Tedros, COVAX works. We delivered in 121 days, quicker, by the way, than in the previous epidemic. But we've only been able to distribute 53 million doses because of the limitations right now. What we need to do is get doses and then allow us to make those available for everyone.
That's great. And so let's talk a little bit about these steps. It's certainly in recent weeks, there's been a lot of attention on the intellectual property issue. And it's more complicated, in my view, than at least has been presented in some of the news reports. But clearly, there are at least 3 areas where we need to push forward very aggressively. And so maybe the next 3 questions with Peggy, Kieran, and Larry, respectively, let's explore them. So one of the things that we need to do is to work with the manufacturers. I mean, certainly we're all aware of the most high-profile manufacturers. There are additional vaccines that it seems are very, very likely to be available in the not distant future. So, Peggy, What do you think is the best way to work most constructively with the pharmaceutical companies to expand their production and licensing? We'll get to the IP waivers and technology pools in a moment, but what's the most that we can do to encourage or even push the pharmaceutical companies to do as much as possible?
Well, right now, the critical thing is to expand manufacturing capabilities and also to ensure, as Seth said, the supply chains for all of the other components of actually making a vaccine that can be delivered to people in the field. And that requires an enormous amount of technical expertise. You can't just sort of go out any old person and start a manufacturing facility for vaccines. It requires working with the companies to build out new manufacturing capacities. It requires also working with the regulatory authorities to help support that process being as smooth as possible. And when we talk about collaboration, one thing that I think has been actually very positive during COVID, frequently underappreciated, is that the regulatory authorities on a national level have come together to work and try to find strategies where they can share the workload, they can share information, they can create common standards and approaches that enable the R&D to have gone forward more swiftly, but also enable manufacturing to go more smoothly and efficiently and to occur in different places without having to do things differently each time. So reducing bureaucratic barriers. But I think we are fortunate. I mean, my mother used to always tell me that it's great to be smart, it's great to be rich, it's great to be beautiful, but at the end of the day, it pays to be lucky. And we have been lucky with SARS coronavirus 2 in many ways. It's been a devastating pandemic, don't get me wrong, but we were very fortunate that it turned out to be a virus where it was relatively straightforward with modern technology and past investments in science to create not one, but a range of vaccines to be able to effectively address it with levels of safety and efficacy that I think exceeded any of our expectations. And the most effective vaccine at the moment, the mRNA vaccines, actually turn out to be probably the simplest and most reliable to produce. So it really, right now, the urgent action is expanding capacity. Expanding supply of vaccines will dramatically enable us to achieve our health equity goals. And it has to be a partnership with government investment, international collaboration, and the companies stepping forward to do their full share.
That's great. And Kieran, you've been a champion of technology pools, as everybody on in this conversation knows, but not everybody who's viewing knows. The WHO last year set up a facility for technology sharing, which hasn't succeeded. So Kieran, question for you is, what should it be? Why hasn't this idea worked so far? And what could possibly be done to address that shortcoming?
Well, you know, IP is a big barrier for any kind of pooling. And I think, therefore, we do need to look at a pandemic patent pool where, you know, a custodian like COVAX or WHO ought to basically create that kind of a patent pool and then license it out to countries who have the capabilities of quickly taking advantage of these new technologies, because tech transfer can only happen when companies who are developing these technologies are willing to share it. And I think this pandemic definitely needs technology sharing. And without some kind of secure patent pool, it is not going to happen. So I think we do need to look at a shared patent pool, which I think needs to be orchestrated or governed by a good body that is reliable and trusted as a custodian of the patent pool, so that actually countries who can produce these kind of new vaccines or other kinds of vaccines can actually take advantage of new technologies and actually produce it for the world. Because again, we're talking about shared resources and shared efforts. So I think unless we do that, I think every one of the panelists has spoken about making sure that the global supply chains are not broken. Today, many of these supply chains are broken for vaccine production. We need to bring it all together because, as everyone has said, we are not safe until we are all safe. And I think the only way to do that is to vaccinate our way out of this pandemic. I'm very convinced that without vaccinating the world, we will not really be able to prevent the next wave and the next wave.
Yeah. And Larry, you mentioned the possibility of an IP waiver. Certainly, there's a lot of attention on that issue. There's also resistance. There's some resistance from perhaps some in the pharmaceutical industry because of future business models. But there are also people who say that companies like Moderna have already said that they have no intention of enforcing patent rights and that may not be the essential linchpin. What do you think is the argument for IP waiver? How could it be carried out in a way that could make a real impact both in the short term and in the long term?
Thanks, Jamie. That's a great question. You know, the whole idea about waiving intellectual property rights has been, as you said, really highly controversial. But I think it starts with a fundamental mistake. Nobody's claiming that waiving intellectual property rights in and of itself is sufficient to deal with this problem, but it's necessary. It's a first step because in a crisis, we have to remind ourselves, we have to knock ourselves on the head and remember we have never experienced this in our lifetime before. This is a once in a lifetime event. The world hasn't seen it since the great influenza pandemic of 1918. So we can't go about business as usual with proprietary secrets. We need to actually share the technology. And so waiving of intellectual property rights, particularly in this crisis, is a necessary thing to do. You can't expect to ramp up manufacturing if trade secrets are kept close to the chest. But it's not enough. Once we've done that, we have to work on all the other things that Kieran and Seth and Peggy so articulately said. We need to look at supply chains. We need to be able to share the know-how and technology. You can't just go in, as Peggy said, to any factory and say, go ahead, start manufacturing this AstraZeneca vaccine or this messenger RNA vaccine. We actually need to have very close partnerships. They need to be public-private partnerships between the pharmaceutical companies and the governments. They need to have an international component, Gavi, and the World Health Organization. And they also need to have partnerships between lower and higher income countries to share. And I think if there was anything emblematic of one shared world, it would be the idea that the only way that we can climb our way out of this pandemic in the reasonably near future is to do it together. And that starts with sharing science, technology, and building up manufacturing capacities. People say we can't do it. And I say that's wrong. We can do it. It is within our capacity, within our vision. We've got the financing, we've got the know-how to be able to ramp up production of these vaccines because we can't just do it by hoarding. We need to do it by sharing.
Yeah, and really critically important points. And so as we've mentioned, the G7 foreign leaders plus other guests are meeting today. The World Trade Organization General Council is meeting today. The World Health Assembly has its meeting in under 3 weeks from now. So I'd like to ask everybody, if you had a very specific message to the leaders, the combined leaders of these groups, what do you think are the two most urgent things that they can and should be doing now? So I'll go to everybody, but maybe starting with you, Seth.
Well, the first thing, and I've already mentioned this, is given the surplus doses that have already been produced, they need to make those doses available. And this should be a clarion call now, initially to try to cover the 190 million doses that we're short because those doses are now being used in India, given the severity of the problem there, so that we can go ahead and continue equitable distribution across the world, covering all the health workers and covering those at high risk. But then what we really need to do is to increase manufacturing. And what's interesting is that we've seen a lot of technology transfer going on now. I think it's very powerful. And as Larry said, it's critical because it's about having technology transfer. One of the challenges we're having is there's so much technology transfer going on that we now have a human resource problem, because the number of people who know the recipes and how to produce things and do that is really a small skill set. And so the challenge has been, how do you get enough of those partnerships going and people able to share that information? But that's what we need in a shared world. And then, of course, lastly, the supplies to be able to make it. I don't want to leave, though, without saying there's a lot of science questions still. We don't know whether one vaccine is enough. Are we going to need boosters because the immunity wanes? Are we going to need different vaccines because of the new variants? Are we going to need new variant boosters because you have some protection and not others? So one of the challenges with all of those, we're going to need more vaccines. And so the challenge is to work together to increase that capacity with equity in mind, and most important, to be flexible following the science. And that's critical. You don't want a situation where a new variant vaccine appears and right back to hoarding and it only being used in wealthy countries and not made available to health workers and high-risk groups around the world. So this is really the priority I would put on the table.
Great. Thank you for that. Peggy.
Well, I have to endorse all of what Seth said. I mean, I think we have to continue to focus and advance the science in critical ways so it can be truly harnessed for the benefit of people. We need sustained commitment from countries rich and poor to work together towards the goal of getting vaccine to people all around the world, and to supporting all of the other programs and activities that will enable that, and ultimately, put us in a position to move beyond this devastating pandemic. We need, solidarity in ways that have proven difficult, but will be essential to success. And I think let's not forget, we've been talking a lot about how to enhance supply, how to create a more transparent and stable, predictable marketplace. But we still also have to think about supporting the on-the-ground delivery of vaccines, which is a challenge. And as more vaccine becomes available, making sure it makes it that final mile, or however you want to describe it, into people's arms appropriately and as efficiently as possible. And we have to recognize that for different reasons, all around the world, there are people who still are hesitant about taking this vaccine, don't have trust and confidence that's really necessary in either the vaccine itself, because of the speed in which it was developed or the political context, or are skeptical about vaccines in general. We still need to work on that as well. So a lot to be done.
Yep. Yeah, thank you. Kieran, your charge to world leaders who are meeting today and going to be meeting through World Health Assembly in this time of crisis. What are your urgent recommendations?
So I think Seth and Peggy have really, elaborated on what all needs to be done. But I would just add that, I think surveillance is a very important collective effort. We don't want variants from one country and another to go undetected. So I think that surveillance information is extremely important. I don't think there's any debate on making sure that, we share vaccines equitably around the world. So like Seth said, if there's any excess vaccines anywhere in the world, we should not be having vaccines in any warehouse. Those vaccines should be out in the world, vaccinating people. We almost need to do real-time vaccination. As the vials come out, I think they should be going to vaccination centers. I know that in India, we need that right now. India, in fact, at the start of this year, felt so complacent and confident that it was in fact even donating vaccines to certain parts of the world before this second wave hit us. And now, of course, we just need to ramp up vaccine production as much as we can to deal with this crisis. But having said that, I'd also like to say that we must also think of a lot of marginalized people who have been impacted by this pandemic. I don't think we realize the poverty that has been created. I think Tedros mentioned that 100 million more people have been pushed into poverty. So I think vaccinating people and getting them back into economic activity is really the need of the hour. So vaccinating fast, so at speed and scale, that is my message to the leaders of this world. Let's vaccinate at speed and scale. And whatever it takes to do that, whether it's ramping up production, whether it is, sharing all the vaccines that are, that have been stockpiled by the high income countries, whatever it takes, I think we just have to get those vaccines out as fast as possible. And as Seth said, we really don't know whether these vaccines are adequate, whether we will need another dose of vaccine. So what is the kind of production capacity that we will need is something which we need to track.
Yeah, I think it's really important. That was actually one of the ideas that we got through our social media. Do we need a vaccine central bank nationally, globally? It should outrage all of us that some countries have massive excesses and vaccines that are just sitting there while people are dying unnecessarily in other parts of the world. And so, Larry, part of our challenge is how do we respond to this emergency while at the same time laying a better foundation so we don't find ourselves as unprepared in the beginning of the next pandemic, which will inevitably come at some point than we were at the start of this. As I mentioned earlier, you've been among the leaders of this call for a pandemic treaty. What do you think a pandemic treaty should entail? I know that we had a number of world leaders have endorsed the idea. What should it entail, and what's it going to take to turn that into a reality? Yeah,
thanks, Jamie. I mean, and also thanks to Karen for really reminding us of the human suffering that this pandemic has wrought, and not just in terms of disease, but in terms of poverty, the impact on women, and the impact, as Seth knows, just on ordinary child vaccination programs and so much more. May I just first give my wish list for the leaders?
Please, yes.
And then go to the pandemic treaty. I mean, I think it would really be two things. One, Seth actually kind of hinted at this early on. One of of all the immorality that we're seeing, to me, the greatest obscenity is that there are so many health workers in the world who are unvaccinated still. And so I would call on leaders, and I would start with my own leader, President Biden. I know him. He's a great, deep, compassionate man and an internationalist, but he's been focusing mostly inwardly. He promised that we'd get 100 million doses in arms in the first 100 days of his presidency. He's way over-delivered. He's doubled that. I would say that the world leaders, including the United States and President Biden, should say that in the next X days, 60 days, that every health worker in the world should be vaccinated. I think that would be one thing that I would ask for. The other is that I think that high-income countries, particularly the United States, have lost their moral vision. They've been so hurt by this, so inward-looking, that there's nothing big and bold coming out. Internationally, there is CEPI, Gavi, COVAX, the ACT Accelerator, are big and bold. But what about, a big program like PEPFAR, or the global eradication of smallpox or the global eradication of polio. We need to be thinking big and bold about what we do. And I think big and bold brings me to the pandemic treaty. We need to actually entrench norms and institutions that go beyond this pandemic. And so, for one thing, I would love to see Kovacs being a permanent facility and one that really has mutual obligations around the globe to actually support and to pledge for equity. On the pandemic treaty, I think we should be thinking about things like not just how we can identify and respond to disease, but how can we prevent it? We know that most novel viruses come from so-called zoonotic spillovers from animals to humans. We know that climate change and changes in our habitat and land management make all of that more probable. We know that live animal markets and the trade in wildlife contributes to this. And so we need to have primary prevention, which is prevention from these kinds of spillovers from animals to humans. Unless we do that, we're going to see more and more of these kinds of events. And then I think we need to have global norms. We need to have independent verification systems, and we need to strengthen the World Health Organization itself. I think it's unforgivable that the WHO has a budget around the size of one large US teaching hospital, wholly incommensurate with its global mandate. And even worse, 3/4 of WHO's budget is earmarked by donors. And so WHO doesn't even have control over most of its own budget. It can't set the global health agenda. So we need strong national health systems. We need strong enforceable norms. We need to work as a one health, one planet approach about climate change, land management, antimicrobial resistance, and strong health systems. There's so much that we can do. We actually do know how to be better prepared as a planet and as an individual country. We just need to have the systems in place and the funding in place and the norms in place to make that possible.
So thank you so much, Larry. I mean, that was such a rich contribution, but some critical points. One, I really like your call is, can we ensure that in 60 days, every healthcare worker in the world is vaccinated? One of the benefits of having this kind of platform and hundreds of thousands of people engaging with this video is, well, let's start communicating that. Somebody out there, please invent a hashtag. Let's reach out to our leaders. Let's make that real. Second point is a really critical one. It's structural change. Now, we can't continually be in this position where we're not prepared. Now, we have some big global problem. We know that the problems that we're going to face, and frankly, it's even bigger than pandemics. That's what One Shared World is all about, this crazy mismatch that we have between all of these global collective problems and the weakness of our institutions by design in many cases that we have asked to address them. The WHO is a case in point, but we could be having this exact same conversation had there been an accidental nuclear explosion, had there been some kind of ecosystem collapse somewhere that had touched food supplies regionally or even globally. So there's this mismatch, and the response must be structural. To make that possible, we need to be delivering different messages to our leaders. One of the reasons why our leaders have failed us is that they have done exactly the job that we have hired them to do. We've said, go out there and defend our national interests. That's the job description for most of our leaders on a national level. And we live in a world that's organized primarily around nations. If we want a different outcome, we have to change that job description, not in the name of one world government, but in the name of our collective self-interest that allows for patriotism, but must allow for us to fight for a common good that helps everybody including ourselves. So a few thank yous, some very important thank yous to end our critically important event today. First and foremost, thank you so much to everybody, all of you who have participated as speakers and discussants. Of course, Tedros and Yasmin, Seth Berkley, Peggy Hamburg, Kiran Mazumdar-Shaw, and Larry Gostin. Thank you. It's like I said before, this was like an Avengers team of superstars. As I mentioned, as Kiran mentioned, there are a lot of ways for people to contribute. But if your heart is broken by what we're seeing in India, and it's not just in India, but certainly in India, we hope everyone will consider making a donation at giveindia.org. It's a highly credible organization, and we have 100% confidence that the funds will be used wisely. If you believe that recognizing the mutual responsibilities of our deep global interdependence must be a foundation for solving our biggest common problems, we invite you to go to our oneshared.world website and sign the Pledge of Interdependence. Join our movement fighting for vaccine equity, but also for other things. As I said before, everybody here, everybody who's listening and joining in any way, you are a leader. This isn't about other people fixing these problems. Everybody needs to step up, and we want to hear from you. We've heard a lot from you on social media. Immediately after this session ends, we're going to begin our discussion forum where everybody is going to be allowed to speak, to share views. It's like a big breakout session somewhere between a breakout session and a cocktail party where you can share your thoughts, listen to other people. The URL for that is oneshared.world/forums. And our amazing young leader, Shagun Sethi, is going to be your guide when you go there. So some very, very special thank yous. First, thank you so much to our One Shared World team. Here's a list of the names of everybody. We are a 100% volunteer organization. We have hundreds of people who are working day and night around the world as volunteers. We don't have a single person who's a paid staff person. That doesn't mean we don't need resources. So certainly if you'd like to support us, we welcome it. But if you're going to give once, please give to India and give to Gavi and give to the other important charities that you've mentioned here. Thank you so much to our partner organizations. The way we're able to do our work is with those partners, our lead sponsor, the Rockefeller Brothers Fund, the African Network for International Education, Democracia Global, the Columbia University Center on Global Thought, and the Model United Nations Impact. We actually have a really exciting partnership with MUN Impact, working toward what we hope will be a United Nations resolution ensuring WASHPAP, water, sanitation, hygiene, and pandemic protection for everyone on Earth by 2030. And you can go to our website if you want to learn more about that. And most importantly, I just want to thank everybody who is joining in any way in this conversation. Your voice is essential to fixing the world's greatest problems. If we want to live in a world where we recognize the mutual responsibilities of our interdependence, and that's the only way we're going to have a safe future, it's up to all of you and all of us. Thank you so much.